Thank you all for joining us for another episode of On Call, Day in the Life of a Healthcare Interpreter. I'm your host for today, David Brackett, also the founder and CEO here at Linguava. And I'm joined by Priscilla Moreno, one of our Spanish healthcare interpreters. Priscilla, thank you so much for being with us today.
Hello, thank you, David, and thank you all.
Well, all right, Priscilla, before we get in, I just want to ask a few icebreaker questions to get to know you a little bit, and then we'll jump into some more interpreter professional related questions. So if that sounds good to you, we will start off with, when you're not interpreting, what is a hobby that you like to do?
Well, it's my hobby, my passion, and my work also. It's to paint. So I'm always either painting or reading or walking in the woods.
Wonderful. Okay, I like it. I like it. That sounds like fun. And I just saw your website is also beautiful. So you have to check out some of Priscilla's art as well. We'll add the website there for everyone to check out.
Thank you.
And what would you say your favorite food is?
That's a very tricky question because I love food. I'm from Mexico, so I love Mexican food, but I also love gummy bears.
Gummy bears. I love it. Nice.
Yeah.
Gummy bears are always a good idea.
Yeah.
Yeah. Do you have a favorite brand of gummy bears?
Oh no.
Anything
Colorful, anything colorful.
Okay.
Yeah.
And if you could learn another language outside of Spanish, English, what language would you learn?
I'm actually learning German. So yeah. And I would love to learn Japanese too.
Excellent.
Yeah.
And if you could snap your fingers and go anywhere in the world right now, where would you go?
In the world, can be that another planet? I would love to visit another planet.
Sure. You can go to another planet if you want.
I would love to try another one.
Okay. Which planet would you go to?
Something very far away, something new, something colorful and magical.
To try a whole new experience. Okay.
Yes.
I like it. Well, great answers, Priscilla. And now on the more professional side of things, how did you get started as a healthcare interpreter?
This is so funny because I never thought about being a professional interpreter. Like I've never thought it was a career. Like I've been interpreting for so many years for friends and for different organizations in my meditation organization. But I've never thought in the healthcare world. So a dear friend of mine told me about Linguava, and I said not for me. I'm not sure about the healthcare world, but I did because it was there. It was presented to me, and I love to take opportunities that are presented to me, right? So I did, and now I'm very, very in love with it.
Awesome. Well, we're grateful to have you on board. Can you think of a moment when you had to really stay grounded and in control, even when maybe a conversation in the room got tense or somewhat complicated?
Ooh, yeah, I've witnessed some of those moments, and I don't have specifically one, but a few of them. And in all of those cases, what I can give to the patient and to the provider is to be fully present and to be fully aware of the moment and of the people there, and to make my best in order to give them my best, like to provide a great service, because they need love in a shape of service, of translation. So that's what I love. Yeah.
And what would you say is a common misconception of the role of the healthcare interpreter?
Well, I'm not sure about that question. Maybe like the people I've seen, like the patients want to talk to me and tell me their stories.
Yep.
And I would love to hear them, but in another moment, right? So maybe it's a misconception that they have, like we're there in order to just chat and, sharing recipes. But I'm sure that I love to be sure that I'm giving them the best and the clearer explanation of what is my role there, and that I'm at their service. And when they understand that, they are very, very grateful.
Mm-hmm. Yeah, it's a beautiful service, really giving that patient a seat at the table
Yeah.
to participate in their healthcare.
Mhm.
And when you're at an interpretation assignment, Priscilla, and let's say there's a particular term that maybe doesn't have a language equivalent specifically, how do you navigate that situation?
I ask. If I don't know, I ask, and I keep it simple to
Mhm.
me and to the provider and to the people, right? So if I don't understand a term that the provider is speaking about, I ask the provider, and they are usually, most of the time, if not always, like very patient and very kind. So it all becomes like a bubble of wanting to help, So it's easy, and it's full of kindness.
Yeah. And can you think of a particular moment well, you've been interpreting and you left at the end of the day just feeling so fulfilled as to like, this is why I do what I do.
I'm gonna sound like a nerd, but every appointment, like I get out and I text my husband or my friend who
Yeah.
invited me to Linguava, and I'm like, I have a fluffy heart right now, because like this job doesn't feel like a job. It's like a service, and like a way of creating community, and like a way of spreading kindness and good service. And I'm being super honest when I'm telling you, like every appointment, I'm like, what an amazing job I have. And yeah, I'm in love. I'm in love with the interpreting. Yeah.
That's so amazing to hear. We can clearly hear the energy and passion that you have. I started out as a Spanish healthcare interpreter as well, so I know that feeling, and it really is incredible.
Yeah.
Last question for you, Priscilla, before we wrap up for today. For any other interpreters that might be listening today and are thinking about getting started, what would be your message for them?
Oh, keep spreading the love and keep spreading the kindness, because I think the world needs that a lot, and we all can help in very different ways. But we are here helping as translators to help people to understand and to have support and to be there for them. Like this is a beautiful way of service, of kindness, and of community. Like we all are habitants of this world, right? So we are here to support each other.
Beautiful. Well, thank you so much, Priscilla, for taking the time to meet with us today. It was a pleasure having you on, and we will connect again soon.
I love this interview. Thank you so much. Thank you for the time.